Welcome to this module on refugee health. My name is Mark Harris. I'm Emeritus Professor of Primary Healthcare at the University of New South Wales. I'd like to begin by acknowledging the traditional owners of the land that we're on and pay my respects to Aboriginal and Torres Strait Islander elders past and present. The learning objectives for this module are to firstly define what a refugee and asylum seeker are and describe refugee populations in Australia. Also, then to go on to describe some of the health and social problems faced by refugees in Australia and the barriers to accessing healthcare that they experience. Finally, we'll talk briefly about some strategies to overcome some of these barriers and the role that community health navigators can play in addressing these. The definition of a refugee is a person who lives outside their own country of origin and who has a well-founded fear of persecution and is unable to return for fear of persecution if they return. In recent years, about 15,000 to 20,000 refugees have resettled in Australia each year. Over the past 10 years, there's been about 180,000 refugees who've been resettled, which represents less than 1% of the total global number of refugees across the world. Asylum seekers have fled from their own country and applied for protection as a refugee. They may arrive in Australia with a valid visa, for example, a tourist or education visa, and then claim asylum, and they're then put on another kind of visa, often a bridging visa E. If their application is initially rejected by the department, then an asylum seeker can appeal, first of all, to the Administrative Appeals Tribunal, and if this is unsuccessful, to the federal court for a judicial review. If this is also then unsuccessful, appeal can be made to the minister to intervene on an individual basis. These processes can take several years, up to 10 years in some cases. So there are a number of common health problems that refugees face, and many of these are common in the Australian population as well. So first of all, there are, of course, many long-term chronic conditions that patients might have. There's a range of infectious diseases, particularly things like hepatitis B, an infection of the stomach called H. pylori, which is a bit more common amongst refugees and asylum seekers. Skin infections, like scabies, for example, HIV or the AIDS virus, and vaccine-preventable viruses, particularly if they come from a country where the vaccination programs are not as good as they are in Australia. They may have also suffered injuries and violence, poor nutrition. It's very common for refugees to have poor dental health care, and there may be child health problems with growth and development, also children with a range of disabilities. Mental health problems are particularly common amongst refugees and asylum seekers. Depression and anxiety is quite common, affecting about 4 in 10 people who are refugees. Amongst these, they may have a post-traumatic stress disorder, a range of symptoms associated with that, which is much higher than in the Australian population. And they may also have severe mental illness. And these are associated with a number of factors. Before departing their country, exposure to war or persecution, economic hardship. In their journey to Australia. They may have suffered life-threatening events, for example, in boats, or they may have suffered physical harm or been trafficked as humans. They may, on arrival, experience problems with not being able to work and not having access to healthcare and having poor housing. And longer term, poor living conditions, adjusting to the Australian culture and social isolation and problems with employment and so on. And also facing the uncertainty about the risk of return and what may be happening to their families back in their countries of origin. All of this contributes to a high incidence of mental illness amongst refugees. There are a number of barriers to accessing healthcare by refugees. Within the refugees themselves, there may be a poor understanding and information on the Australian healthcare system and treatments that may be offered. This is an example of some quotes from a health worker about the lack of information that refugees may suffer. They may not understand why they're needing to have certain tests or what certain tests involve, especially things like screening tests. Language is, of course, a barrier and can be a major problem for people accessing support. And people may be getting support from relatives or friends in Australia who themselves might not be aware of services and what services are available. People may have to travel long distances to find a healthcare worker, a doctor, for example, that speaks their languages and is from their cultural background. There may be problems with the expectations of other healthcare workers about how they should behave or their healthcare. Within the consultation, time is a major problem. This can affect the amount of time that's given to explaining why people need to go to services and how to get there. Interpreting consultations can take a lot longer than not using an interpreter just because of the time involved in translation. There may also be problems with information. There may be written information available, but not in the language that the person needs. And lastly, there may be barriers to healthcare. For example, cost may be a barrier, and there may also be long wait times in the public health services. So this is particularly a problem with things like dental health care. So these are just some of the barriers that we've found in some of our previous research are important barriers to refugees accessing healthcare. So what can we do about it? So the first thing is in approaching these problems that refugees are experiencing, it's important to be sensitive to the previous experience of trauma, which may not only influence people's mental health, but also how they respond to healthcare. So, for example, if they've experienced physical trauma during imprisonment from healthcare workers, or they may have had torture, that may make it very difficult for them to accept certain sorts of treatment. There may be problems with lack of information and cultural and language barriers, and these are things which we believe are really important areas that community health navigators can help address. Trying to help people to understand information that's been given to them, to to find information that's available in their own languages and is appropriate, and also to access cultural and language appropriate services, whether they're healthcare services or services more broadly in the community. We can help refugees by helping them to make appointments. Often it's quite difficult for refugees who don't understand systems to ring up and go through a complex process of finding the right person to talk to and then making an appointment. Then getting to those services, physically getting transport to those services, and knowing where to go, obviously, which may be not just a question of finding your way on a map, but within a hospital, for example, finding the right place to go for a clinic. Helping people to improve their health literacy. This is important because we don't want to make people dependent on our help for long periods of time. We want to help them to gain knowledge and confidence to be able to look after their own healthcare as much as possible. And building their trust in health and health system. So for a variety of reasons, due to their previous experience, people may feel not very trusting in the health system. They may be not trusting interpreters who they might feel might relay some of the information that's given to other people. So helping to reassure them about that they can trust providers and can get the sort of care that they need. So that's the end of this lecture. Thank you for your attention. Look forward to seeing how you go in the quiz associated with the module.